The other thing that's very important is if your grafts are well spaced out apart, you can potentially see them as grafts. So you want to keep them relatively tightly interlocked. And interlocking it is something we're going to show in the next slide and have you understand that. The other temptation when you're working on the frontal hairline, because your hand goes like this, is to splay all your grafts out like this, which doesn't look natural. It's very uncombable. In addition to that, it doesn't create density, because if you think about it, if you can interlock your grafts going forward and front, they tend to don't book leaf open, and you can create a much greater visual density with the same number of grafts as someone else doing it this way. So you don't want to book leave open everything. And again, that concept will be reinforced with the hands-on work as we reinforce and see how you make your sites. Before you start making your sites, you want to make sure that the grafts that are being made fit. So we always test with each size the length of the graft, and then after we make a few test sites, we then go back and make sure that that graft actually physically fits, and sometimes we need to make some accommodations. So 2 or 3 small sites, make sure the grafts fit before you engage in making 500 sites. So what I usually do is after I start getting back my initial numbers, you first have calculated what you want to, how many grafts per a certain distance, and once you've gotten that idea of where you want to go with it, you want to then find out exactly, based on a graft calculation, I'm going to, it looks like you're going to have a certain number of 3 hair grafts, certain number of 2 hair grafts. Then I visually plan how many 2 hairs need to be here, how many 3 hairs here, and that's going to come with experience. And some of those elements we're going to discuss more in the workshop. But the goal is to be able to allocate effectively, because you could put, for example, more hairs in the part or more hairs in an area like the forelock, which is in the front, which adds more visual density for someone. So you want to target those areas that have maximal visual density with a little bit higher visual density than areas that may be less important. For example, maybe a little bit further back in the mid-scalp, or areas where it's the opposite end of the part. Because the part is where there's a lot of travel distance for your hairs. And it's also, if you think about it, right here is more splayed open. So you can see emptiness if you don't put enough hairs in that region. So those are some finesse points that I think are going to be important as you actually go and do this with us in the actual live workshop portion of this. And so the other thing that's important is what I do is I try to put make my sites in the most important areas, because I don't want to run out of grafts. So I'm always mentally calculating as I'm making, okay, I need 300 sites in this area. Well, I need definitely 150 in the front, which are going to be very dense. Then I can feather back. But if I start making them in unimportant areas and I start running out important areas, then we're in trouble. So mentally calculating on the front end where those sites are going to be, I think is very, very important. So we've talked a little bit about the forelock, and this concept is that if the forelock is the area right behind the hairline toward the center, it adds the greatest visual punch, because people looking at you from all different angles give you that visual density when you're seeing the center, because the hairs, every hair that's in the center is adding visual density from someone looking at it from all angles, versus a hair on the side, which is a little less important because it only adds visual density for someone coming from this side. The finesse point of that idea is really to judge it based on the patient's needs. For example, let's say the person has a lot of hair in the center and just has really deep gullies here. Well, you're going to reverse that concept and look at areas that need the grafts. So if they have a lot of hollowness here, you're going to focus more on the frontal temporal recession. And that's part of the art, is distributing those grafts in such a way, or those sites in such a way, that you get maximal visual density customized for the patient's loss. The extended central forelock principle is that if we think about it, if we take that forelock here and move the hair all the way to the back, then that is going to provide a cutoff point in almost all angles coming, a visual cutoff point of people looking all the way back, versus just the central forelock. If someone sees it here, you're going to see behind the central forelock. So that idea of the extended central forelock is an area that is very important to prioritize density for site distribution. So how do you do it? If you're using slightly larger grafts or multifollicular grafts, I start with that and create that central forelock anterior portion of the mid-scalp first, and then go all the way back and finish that, because as I go forward and blend in my smaller grafts, I can more tightly interlock them going forward than the other way around. I don't know if you can understand that, and we can do some of that in the lab. And then I build my hairline forward, which is very important. If you start with the line, sometimes it looks too linear. If you start back behind the line and move it forward, you can create a line that is not quite a straight line. You want it to be a little bit blurred, and that's really important. So what about the hairline? The hairline should be relatively aligned. It shouldn't be too jagged. Some people I see, the mistake with the hairline is either that it's just so jagged, like, you know, 2 or 3 centimeters of big curvy lines, and that's not how a hairline looks, or it's just too straight. So what is important is it's almost like a coastline. It's something that Advanced taught me, which is a very, very fine coastline. As you get closer to it, you start seeing those little irregularities of only a few millimeters. And that's something that's important. And that hairline, as I said, especially where the grafts can be exposed, should not be just widely open recipient sites. They should be relatively on the tighter side of things. And then coming back, I skipped that, is making what's called sentinel hairs, which are just hairs standing out in the front, so that it's not just this wall of hair, but there are these little break points of hairs that stand maybe about 1 centimeter or half a centimeter in front of the hairline. Look for holes. As you make your site design, you want to be using mag eyes or magnification and making your perfect pattern as best you can, then coming back and taking a look and making sure your pattern is symmetrical, that you're not angling your sites off to one side by accident, that your hairline's not getting crooked. You know, come back and look at it from different angles. Make sure you didn't leave holes in your pattern. Come back and recheck constantly by magnification and non-magnification, and that's going to be very important. And if there's any vascular compromise, you're making these sites, some areas that look dusky or white, nitro paste is always important to have on hand, in my opinion. Again, this is just some sites that I've created here. These are sagittal-based sites, you can see. And you can see that the hairline is pretty straight, but there's a little zone of irregularity. And then there's these, you can see those little hairs that stick out. We talked about sentinel hairs that just blur the line a little bit, but it's not a jagged line. It's just a micro-jagged line. And that's something I want to emphasize. These are coronal-based sites. We talked about that, which I like to use those in the temple. And the temple is an area that I really encourage you, if you're just starting, don't do temple reconstructions, because if they're not flat and well angled, they look very artificial. And if they're not placed well by your technicians, they look very, very bad. So the coronal sites, remember, are the ones that go like this to the skin, and that allows me to get my angles really, really flat. So I tend to prefer to use the coronal sites for the temple area, where I can keep my angles relatively flat, really, really flat. This is very low. This has got to be super, super low in the temple area. This is just a close-up of my hairline work. You can see it's pretty straight. And if anything, actually, what's interesting is if you look at this, there is actually, do this. There's a little hole in the front, and I don't know how to get this, work here. But there's a little hole in the front. That little hole in the center front is an area that I should go back and make a site for. So it's just something when you're going back and checking, it's toward the midline if you see it. This is a vertex or recipient site for the crown. You can see it's a whorl pattern that blends up to the center. This is more of an advanced recipient site creation. We're really going to be focusing on mid-scalp, but hopefully there's a little time to show you that as well. And this is a female pattern hairline. It's not the same as a male oftentimes. There's a cowlick. There's a little bit of a curve shape. It's a much more advanced topic. We may not get through all of that in this course. It's going to be focused on male hairlines, but tomorrow during the workshop there's going to be a little time extra for that. And these are just some results. You can see the cowlick. You can see fixing what's a male pattern loss into a more feminine design. You can see that the hairline on the left is too straight. The angles are poor. It looks almost kinky because of the way that the assistants place the grafts in, and you're going to hear a little bit about assistant quality control. This is a one session correction of that. Also poor density. This, you can almost see the pitting where the grafts are placed too deeply. The angles are poor. The hairline design is not natural. And this is just, it's a one session correction for that. You can clearly see here why the graft angles the recipient site angles and the concurrent graft angles have to be low, because the angles are so high on the left that they look completely artificial. The hairline's too straight, it doesn't match the temples, and this is a reconstruction of that. And they're just showing you what kind of visual density you can create when someone has good donor hair density to rebuild the whole area. So the conclusion of this is really thinking about how hair grows and how hair is lost. If you can understand those principles, it begins as the first stage of knowing how to rebuild hair. If you understand how hair grows and how hair is lost, then you can actually recreate the patterns that represent a natural look. So I'm going to do a live 3D demo in a few minutes right here. Barbara, is she here? Great, okay.